But 5 years from now, what will it look like if we take these lessons and apply them well? And you can talk about any of the different areas in terms of surveillance, in terms of public health, or that kind of stuff. What will it look like in 5 years if we learn the right lessons?
Yeah. Well, listen, I think that we have to do a better job of investing in the public health workforce. Clearly, we have seen major gaps in sort of talent and people that can respond, that public health departments are severely underfunded and under-resourced. I mean, we're expecting public health departments right now to maintain surveillance and efforts, but while at the same time now roll out a vaccine, it just doesn't work well. I mean, I understand the need to have distributed and local-based public health, but at this level of distributed effort, it creates so much dysfunction and unevenness of resourcing in terms of public health. So hopefully some of the new support that's coming at the federal level will help to even the playing field. I think that, of course, we need to strengthen our ability to respond to global threats. Over the last several years, we've had significant underfunding of efforts. I was part of a project funded by USAID to look for novel coronaviruses in populations, and that project was defunded last summer. So bad timing to defund a novel coronavirus surveillance project right before a pandemic, but that happened. And so hopefully some of these larger efforts that are involved in sort of field-based surveillance to identify new viruses, or efforts that are about strengthening global public health surveillance. And then I think at a federal level, there's this hope and a push right now to invest in sort of a national disease forecasting center, which applies some of the principles from weather, where you're where you're both nowcasting but also forecasting. And in this case, it would be diseases. What is the outlook, and how do we bring the discipline of disease surveillance and modeling and bring that to a federal level where we have full visibility on what is happening across the wide spectrum of pathogens. I mean, the likelihood that we're going to see another pandemic is significant. Who knows what the timing will be for that, but hopefully core sort of underlying resources will come to sort of make sure that we are ready. And then again, the last thing I'll just mention is diagnostics. We have not done a good enough job to fund and develop at-home, rapid, connected diagnostics that can give us that quick view of what's happening at a population level. Those are things that we should have been implementing years ago. And I think there's real technology that could be put out.